Good day everyone, we are Group 7, your first presenters for these finals, and we are assigned to discuss this topic, the reproductive health, contraception, and infertility. So here's the sequence of our presentation. Reproductive health contraception will be tackled by yours truly, Blessed Tumanda, along with Charmin Bolo. And in infertility, this will be tackled by Arlene Villegas and Abu Samel Kalolong. Once again, good day amigas, amigos. I'm Blessed Maris Tumanda from 1YAMG09. This course is Human Reproduction and I'm going to tackle the first part of reproductive health, contraception. So our objectives for this are examine the various options for control of fertility from contraceptives to abstinence, describe effectiveness of each form of contraception, learn the contraindications for various contraceptive methods, and we hope to meet this at the end of this discussion. First and foremost, let's define first what is contraception. Basically, it's a way for men and women to prevent pregnancy. Also guys, do you know birth control has been used since ancient times, but in our present century, we have the most effective and safe methods of birth control. So in birth control methods, we have reversible methods. Individuals who use reversible birth control can stop using if they want to get pregnant. Permanent methods, once executed, permanent techniques cannot usually be reversed. So once done, you can't undo it. And other forms of pregnancy prevention in which we can tackle here the idea of abstinence and such. So let's tackle first the reversible methods. In reversible methods, we have the long-acting reversible contraceptives. These contraceptive methods allow individuals to prevent pregnancy for multiple years. Also, we have contraceptive injection. We have short-acting hormonal methods. It alters the ovulation, so there's no release of an egg. We have barrier methods. It blocks the sperm from reaching and fertilizing an egg. So in long-acting reversible contraceptives, the first one we have is IUDs. IUD is a T-shaped device that inserted into the uterus by a doctor. There are actually two types of IUD, copper and hormonal. We will tackle that after this one. So the copper IUD contains no hormones and is made with copper and plastic. The copper acts as a spermicide. A spermicide is a substance that kills sperm. The copper can be kept in place for 10 years. The copper stops the sperm from making it through the vagina and uterus to reach the egg and preventing fertilization. So its effectiveness is 99.2% with typical use. Contraindications for this is heavier menstrual flow. This might be caused by vascular changes which regulate the blood flow of the uterus and increase in cramping and backaches during monthly periods in some women. And then we have the other one, the hormonal intrauterine device. So hormonal IUD lasts up to 3 to 5 years. This IUD works by causing the cervical mucus to become thicker so the sperm cannot reach the egg. The hormone also makes the lining of the uterus thinner and less likely to promote implantation. It is 99.8% effective with typical use. So its contraindication is irregular bleeding, though the bleeding tends to be light. So it has the opposite effect from the copper IUDs. Periods typically becomes lighter since the lining of the uterus is thinner and less painful with time. But then again, women may suffer from irregular and unpredictable bleeding for up to the first 6 months of use. Subsequently, we have the contraceptive shots, an injection of progestin. It stops the ovaries from releasing eggs and also thickens the cervical mucus, which keeps the sperm from getting to the egg, just like hormonal intrauterine device but through injection. Individuals using this method get the shot from their doctor once every 3 months, a shot of a progestin hormone either in the muscle or under the skin. It's 94% effective including women who don't get the shot on time, but it's 99% effective when using the contraceptive injection regularly. So its contraindications, loss of bone density, irregular bleeding or bleeding between periods, headaches, nervousness, dizziness, abdominal discomfort, and weight gain. Next one, we have the birth control pill. It keeps the sperm from getting to the egg and stops the ovaries from releasing eggs. There are two main kinds of this: combined pills, which contains estrogen and progestin, and mini pills, which only contains progestin. So it's 99% effective if you use it perfectly. The pill is 99% effective, but of course people aren't perfect and it's easy to forget or miss pills. So more commonly, its effectiveness lies around 91%. And its contraindication is spotting or bleeding between periods, nausea, breast tenderness, and headache. Next one, we have the birth control patch. Just like the combined pill, it has two hormones, estrogen and progestin, that stops the ovaries from releasing eggs. It also thickens the cervical mucus, which keeps sperm from getting to the egg. So it's easier to use compared to pills. You don't have to remember to take your pill every day, but just have to change the patch once a week. So birth control patch is effective as the birth control pill. Thus, they have the same effectiveness, which is 91% effective. But then again, just like the pill, when used correctly, the patch is more than 99% effective at preventing pregnancies. And again, we people are imperfect, so yeah. So the chance of getting pregnant depends on whether you use the patch correctly. Next one, we have the vaginal ring. It releases same hormones as the contraceptive pill, estrogen and progestin, stops the ovaries from releasing eggs, thickens the cervical mucus, which keeps sperm from getting to the egg, so same. If you start using it during the first 5 days of your period, it will work right away, and you won't need backup birth control. But if you start on any other day of your cycle, it takes 7 days to be protected from pregnancy. So for the first week, use condom or internal condom if you have vaginal sex. Its effectiveness is 91% and its contraindication: vaginal discharge, discomfort in the vagina and mild irritation, headaches, mood changes, nausea, and breast tenderness. So moving on to our barrier method. So in here guys, all methods that I'll mention here are physical barriers that blocks the sperm from reaching and fertilizing an egg. So first one, we have the male condom, a thin film sheet placed over the erect penis. And did you know that there's a female condom? Because I was 2 years old when I learned that females have condoms too. So well, yeah, maybe some of you know this already. Okay, so anyhow, the female condom is a thin, soft, loose-fitting pouch with a flexible soft ring on each end. It consists of nitrile, which is commonly used to make surgical gloves. Some female condom products are made of heat-transmitting materials. So male condom is 82% effective, and its contraindication is irritation and allergic reaction. So if you have allergic to latex, which is the common condom, you can try condoms made of polyurethane. This is an alternative to latex. While they don't differ from each other, it's just polyurethane contraception is a little more prone to breakage, so they are slightly less effective compared to latex. And female condom is 79% effective. Its contraindication is discomfort or pain during insertion of sex, burning sensation, rash, or itching. And do you know guys, condoms reduce the risk of STIs, sexually transmitted infections, but the condoms cannot provide absolute protection against STIs. Also guys, addition, if you were thinking, can I and my future partner use condoms both for double protection? Well, to tell you guys, it will not give you extra protection. But if you really want double protection, then you can use condom along with other birth control methods I mentioned earlier, like IUDs or pills. Next one, we have the diaphragm and cervical cap. Before you use this, you need to put spermicide inside them. Again, spermicide is a substance that kills sperm. It can be foam, cream, or jelly. So it's 77 to 88% effective. You should have the diaphragm check after the childbirth, because if it doesn't fit you, it will not effective. Also in cervical cap, it may not work as well for women who have given birth. Childbirth stretches the vagina and cervix, and the cap may not fit as well. Its contraindication is irritation, allergic reactions, abnormal pap test, urinary tract infection, and containing N9 can irritate the vagina and rectum. Next one, we have the sponge with spermicide. The sponge is a small disc-shaped device made of soft plastic foam. The spermicide in the sponge is placed inside the vagina, covering the cervix prior to having sex, and works by continuously releasing spermicide to kill sperm. So it's 77% effective to those who gave childbirth, because it stretches the vagina and cervix, and the sponge may not fit as well. So its contraindications is irritation and containing N9, nonylphenol 9. This can irritate the vagina and rectum. It may increase the risk of getting HIV, the virus that causes AIDS, from an infected partner. So moving on to our permanent methods of birth control, we have what we call sterilization. It is a form of contraception that is meant to be permanent. First, we have the tubal ligation. The fallopian tubes are black. This stops you from getting pregnant, and it is supposed to be permanent, but sometimes it is possible to reverse the sterilization, but reversal involves other surgery that might not work. It is 99% effective, with its contraindications as pain, bleeding, infection, or other complications after surgery. Next one, we have the vasectomy in male. This procedure involves cutting, tying, or blocking the vas deferens. The vas deferens, the tubes that carry sperm from the testes. After the surgery, the semen, the fluid that comes out of the man's penis, has no sperm in it. It takes about 3 months to clear sperm out of man's system, so you need to use another form of birth control until a test shows there are no longer any sperm in the seminal fluid. It is 99% effective, and its contraindications are pain, bleeding, infection. And this method is for men who are sure that they never want children anymore. And now, let's go on to our other forms of pregnancy prevention. First, we have the abstinence. This method is the only 100% effective way to protect against pregnancy, ensuring there is no exchange of bodily fluids such as vaginal secretion and semen. Subsequently, we have the rhythm or natural family planning and fertility awareness. This method helps women and couples become more familiar with the signs of ovulation and the pattern of the menstrual cycle to understand how to plan sexual activity to either avoid pregnancy or become pregnant. Next one, we have the lactational amenorrhea method or LAM. The lactational amenorrhea method is natural short-term birth control method in which a woman relies on exclusive breastfeeding after birth to prevent pregnancy. Lactational means breastfeeding, amenorrhea means having no monthly period. So it is 94% effective in women who do not experience menstrual bleeding and continue to breastfeed exclusively. And next one, we have the withdrawal or pull-out method. This prevents pregnancy as it stops the sperm from entering the vagina and therefore prevents pregnancy. Withdrawal is effective in preventing pregnancy about 96% of the time, but with perfect use of this method. So perfect use of this method would mean pulling out before ejaculation every time you have sex and ejaculating outside the vagina and away from the genitals. But then again, it's not recommendable contraception because even with perfect technique, sperm can be released even before ejaculation, and this pre-ejaculate can cause pregnancy. And the very last, emergency contraception. Emergency contraception is birth control that a person can use after unprotected sex. If you did not use birth control or if regular birth control failed, it should be used as soon as possible within 3 to 5 days after unprotected sex to prevent pregnancy. Emergency contraception methods are more effective the sooner they are taken. So emergency contraception does not work if the person is already pregnant. So that ends my part. Again, this is Blessed Amanda. Thank you for listening. God bless.
So hello everyone, by the way, my name is Charmin Joyce Bolo. So today we are going to tackle the principles of patient selections regarding contraceptives, kung saan dito nyo malalaman sa pagpili ng contraceptives or tinatawag nating birth control upang maiwasan o ang pagpipigil ng pagbubuntis kung kinakailangan kung hindi ka pa handa at kung ano ang paraan ng pagpili at prinsipyo nito. And also we have here the benefits and risks for each form of contraceptives. So dito malalaman kung ano ang taglay na benepisyo na dulot nito sa paggamit, kung ano-ano ang maidudulot na masama ng bawat uri ng contraceptive. So what are the principles of patient selections regarding contraceptives? So first is choice of contraception. The second one is acceptability of contraceptions. And the last one is access of contraception. So first is choice of contraception or choosing the right contraception for you. So the kinds of birth control that work the best to prevent pregnancy are the implants and IVs. So there are also the convenience to use and the most foolproof when you are choosing the methods of contraceptions that is right for you. It is important to have accurate information and to talk openly about your opinions with any partner. It is also important to think about your options with any partner. It is also important to think about how well each method works, the possible side effects, and how easy it is to use and how much it costs. What birth control are available? So your birth control options are barrier methods, short-acting hormonal methods, long-acting hormonal methods, sterilization, spermicides or vaginal gel, and the fertility awareness. Much higher effective, any methods of contraceptions must be used consistently and correctly. Contraceptives that require a lot of effort on your part, such as IUDs, contraceptives, implants, and fertilizations, are associated with lower pregnancy rates, and contrast methods that require monitoring fertility or periodic abstinence are associated with higher pregnancy rates. The methods of contraception you choose depends on your reproductive goals. If you are planning pregnancy in the near future, you may want a method that easily stop or quickly reversible, such as short-acting hormonal methods or a barrier methods. If you want to prevent pregnancy for a longer amount of time, you may consider a long-acting hormonal methods such as an IUD. You may ask your insurance provider about your coverage and then consider the expense as you make a decision. Knowing our options is definitely part of the decision process, but an honest assessment of yourself and your relationship is just as important when deciding which type of birth control is right for you. So when we say acceptability, can be assessed directly by asking about intended hypothetical use and assessing satisfaction during and after use. So since they have been around for a very long time, there are very few data of these natures on condoms as contraceptives rather than our preventions of infections, withdrawal, or vasectomy. So however holistic approach to contraceptive sexuals, acceptability is needed to capture the full range of women's sexual experiences. So sexual acceptability are how methods influence the user's sexual experiences, which can in turn influence family planning, preferences, and practices. And lastly is the access of contraception. So when we say access of contraception, it is the woman must have an access to reproductive health care, including the full range of contraceptive choices to fulfill this right. I have now the benefits and risks for each form of contraceptives. So first is the condoms are the only form of contraceptions that also protect against STI. It is the best protections against STIs can be used to on-demand hormone-free. Kung gagamitin mo ang mga ito ng tama sa tuwing nakikipagtalik ka, ang mga male condom ay napakabisa sa pagpipigil sa pagbubuntis at sa paghahatid ng human immunodeficiency, virus or HIV, ang virus na nagdudulot ng AIDS. So binabawasan din ng mga kondom ang panganib ng impeksyon mula sa iba pang mga sexual transmitted infection or STI tulad ng gonorrhea at chlamydia. Also, we have the risks of this kind of contraception. It can tear or come off during sex if not used properly. Some people are allergic to latex condoms. So, ang mga kondom ay maaaring mag-trigger ng latex allergy. Ang mga reaksyon sa latex ay maaaring magsama ng pantal-pantal, runny nose, at sa malalang kaso, paninikip ng daanan ng hangin at pagkawala ng presyon ng dugo. So the second one is the oral contraceptive pill. It's taken once a day and currently the most common contraception use. So this birth control pill is safe, simple, and convenient way to prevent pregnancy. Taking a pill included the highly effective when used correctly, permits sexual spontaneity, and doesn't interrupt sex. Some pills may even reduce heavy and painful periods and or may have a positive effect on reducing acne. So mayroon din itong iba pang mga benepisyo tulad ng ginagawang mas magaan at mas regular ang iyong mga regla at pinapawi ang mga panregla. So here are the risks to this contraception. Forgetting to take your pill means it won't be as effective. It can only be used by women. It's not suitable for women who can take estrogen-containing contraception. It does not protect against STI. It can increase your blood pressure. It does not protect you against sexually transmitted infection. So, ang breakthrough bleeding at spotting ay karaniwan sa mga unang buwan ng paggamit ng tableta. Ito ay naiugnay sa mataas na panganib ng ilang malubhang kondisyon sa kalusugan tulad ng namumuong dugo at cancer sa suso. So the next one is the intrauterine device IUD. So offer very effective protections against pregnancy. This multi-shaped device is made of material containing progesterone, hormone, or plastic and copper. It is fitted inside the woman's uterus by a trained healthcare provider. So it is a long-acting and reversible method of contraception, which can stay in place for 3 to 10 years. So depending on type. So IUDs containing coppers are 99% effective and ones containing hormones are 99.8 effective. Kaya halos protektado ka hanggat maaari sa pamamagitan ng isang paraan ng pagpipigil sa pagbubuntis. So they are safe to use if you are breastfeeding. So now, here are the risks of this kind of contraception, which is irregular bleeding and spotting occurs in the first 6 months of use, requires a trained healthcare provider for insertions and removal. This not protect you against STI. What are the possible complications of using an IUD? The possible complications of using an IUD include perforations, pelvic infections, and expulsions when the IUD partially or completely comes out of the uterus. So since the IUD insertion is performed by the health professional, perforation is very rare. So the fourth one is the contraceptive implant. The contraceptive injection uses progestogen to prevent pregnancy. In this method, a small flexible rod is placed under the skin in a woman's upper arm, releasing a form of the hormone progesterone. The benefits of this is the implant included highly effective, doesn't interrupt sex, is a long-lasting reversible contraceptive option. So the implant works as well as sterilization and IUD. So ang mga implant ay isa sa pinaka-epektibong paraan na maaari mong makuha dahil halos walang paraan na maaari mong guluhin ito. Kung makakalimutan gamitin ito o gamitin ito na hindi tama, napakamurang paraan ng pagmatagalang pagpipigil sa pagbubuntis, maihahambing sa mga intrauterine device, ligtas sa karamihan ng kababaihan. Epektibo ito para sa 3 taon ng walang karagdagang intervention or madaling alisin sa karamihan ng mga kaso upang payagan ang pagbubuntis sa natural na mangyayari. So of course, we have here the risk. So sometimes there can be irregular bleeding initially, does not protect against STI. So ang mga side effect na nauugnay sa contraceptive implant ay kinabibilangan ng pananakit ng tiyan o likod, mas mataas na panganib ng mga hindi cancerous sa ovarian cyst, mga pagbabago sa pattern ng pagdudurugo ng vaginal, kabilang ang nawalan or kawalan ng regla or amenorrhea. The next one is the emergency contraception pill or the morning after pill. So emergency contraception can be used after having sex to prevent pregnancy. A condom has broken during sex or a woman has been sexually assaulted. So here are the benefits, which is morning after pills can help to prevent pregnancy if you had unprotected sex. So maaring dahil hindi ka gumamit ng birth control, hindi mo nakuha ang birth control pills or inatake ka ng sexual or nabigo ang iyong paraan ng birth control. Ang mga morning after pill ay hindi nagtatapos sa pagbubuntis na itinanim. So now, here are the common side effects of the emergency contraceptive, which is include nausea, vomiting, and the next periods may be early or delayed. Ang mga side effects ay hindi karaniwang ang mga ito ay banayad at karaniwang malulutas ng walang karagdagang mga gamot. Next is the contraceptive ring. So it is release a lower dose of hormones to control a woman's ability to conceive in other contraceptive methods like the pill. So this method, which is consists of a flexible plastic ring constantly releasing hormones that is placed in the vagina by the woman. So here are the benefits of this contraceptive method. Has few side effects that allows control of your periods and allows your fertility to return quickly when the ring is removed. So ang singsing ay mayroon ding mga iba pang mga benepisyo tulad ng pagbabawas ng acne, paggawa ng iyong mga regla na mas magaan at mas regular at magpapagaan ng menstrual cramps. Although we have the risk that you may not feel comfortable inserting or removing it from your vagina. Maaari kang magkaroon ng spotting at pagdurugo sa mga unang buwan. Maaari itong magdulot sa mga pansamantalang epekto tulad ng tumaas at paglabas ng vaginal, pananakit ng ulo, pagdudurugo, lambot ng dibdib at mga pagbabago ng mood. So we have also the diaphragm is a small soft silicone dome is placed inside the vagina to stop sperm from entering the uterus. It forms a physical barrier between the man's sperm and the woman's egg, like a condom. Which is, we have heard the benefits, which is maaari mong gamitin ang parehong diaphragm ng higit sa isang beses at maaaring itong tumagal ng hanggang 2 taon kung aalagaan mo ito. The risk, which is using diaphragms, can take practice and requires keeping track of the hours uncertain. The diaphragms works fairly well if used correctly, but not as well as the pill is contraceptive implant or an ID. Ang mga side effects ay kadalasan nagpapakaunti or maaaring pataasin ng paggamit ang panganib ng bacterial vaginitis at infection sa ihi kung naiwan sa ari ng higit sa 24 na oras. Maaari mangyari ang toxic shock syndrome. This one is the sterilization. Can be permanent. It's only suitable for people who definitely do not want to have any children or any further children in the future. Sterilization is available for both women and men. It is performed in a hospital with general anesthesia. Here are the benefits, which is more than 99% effective at preventing pregnancy, but use contraceptions until your next periods at halos walang paraan na maaari mo itong guluhin o gamitin sa maling paraan. Pinoprotektahan ka nito mula sa pagbubuntis ng 24/7 para sa natitirang bahagi ng iyong buhay. The risk, which is there's a very small risk of complication including internal bleeding, infection, or damage to the other organ. Kung nabuntis ka pagkatapos ng operasyon, may mas mataas na panganib na ito ay isang ectopic na pagbubuntis.
Good day everyone, I am Arlene Villegas and I will be the one to discuss the causes and treatments or techniques to overcome infertility. The objectives of these lessons are, first, to explain the causes of infertility, and second, to compare and contrast techniques to overcome infertility. So what is infertility? So infertility is a condition where you cannot get pregnant after 1 year of trying to conceive. It is defined as trying to get pregnant with frequent unprotected sex for at least a year with no success. So infertility results from female factors about 1/3 of the time and both female and male factors about 1/3 of the time. So the cause is either unknown or a combination of male and female factors in the remaining cases. For pregnancy to occur, every step of the human reproduction process has to happen correctly, but a number of factors can disrupt this process at any step. So female infertility is caused by one or more of the factors in the following. So here are the causes of infertility in women. The first is ovulation disorders. The second one is damage to fallopian tubes. The next one is endometriosis. And the last one is uterine or cervical causes. Now let's move on to the first causes, which is the ovulation disorders. Ovulation disorders or ovulating infrequently or not at all accounts for most cases of infertility. Problems with the regulation of productive hormones by the hypothalamus or the pituitary gland or problems in the ovary can cause ovulation disorders. There are 4 causes of ovulation disorders. The first one is polycystic ovary syndrome or PCOS. PCOS causes a hormone imbalance which affects ovulation. So PCOS is associated with insulin resistance and obesity, abnormal hair growth on the face or body, and acne. So it's the most common cause of female infertility. The next one is hypothalamic dysfunction. So 2 hormones produced by the pituitary gland are responsible for stimulating ovulation each month: follicle stimulating hormone and luteinizing hormone. So excess physical or emotional stress, a very high or very low body weight, or a recent substantial weight gain or loss can disrupt production of these hormones and affect ovulation. So irregular or absent periods are the most common signs. Primary ovarian insufficiency, also called premature ovarian failure. The ovary no longer produces eggs and it lowers estrogen production in women under age 40. So this is usually caused by an autoimmune response or by premature loss of eggs from your ovary, possibly as a result of genetics or chemotherapy. So another one is too much prolactin. So this is the last one. This can also be caused by medications you're taking for another condition. So the pituitary gland can cause excess production of prolactin, which reduces estrogen and can cause infertility. Damage to fallopian tubes are one of the causes of infertility. So damaged or blocked fallopian tubes keep sperm from getting to the egg or block the passage of the fertilized egg into the uterus. So causes of fallopian tube damage or blockage can include, first one is pelvic inflammatory disease. So an infection of the uterus and fallopian tubes due to chlamydia, gonorrhea, or sexually transmitted infections. Next one is previous surgery in the abdomen or pelvis. So including the surgery for ectopic pregnancy in which a fertilized egg implants and develops somewhere other than the uterus. So usually in a fallopian tube. The next causes of infertility is endometriosis. So endometriosis occurs when tissue that typically grows in the uterus implants and grows in other places. So this extra tissue growth and the surgical removal of it can cause scarring, which can block fallopian tubes and keep an egg and sperm from uniting. So endometriosis can also disrupt implementation of the fertilized egg. So the condition also seems to affect fertility in less direct ways, such as damage to the sperm or egg. Uterine or cervical causes. So several uterine or cervical causes can interfere with the egg implanting or increase the risk of miscarriage. So benign polyps or tumors, fibriods or myomas. So these are common in the uterus. Some can block fallopian tubes or interfere with implantation, affecting fertility. However, many women who have fibriods or polyps do become pregnant also. So problems with the uterus present from birth. So unusually shaped uterus can cause problems with coming or remaining pregnant. Another one is cervical stenosis, a narrowing of the cervix which caused by an inherited malformation or damage to the cervix. The last one is sometimes the cervix can't produce the best type of mucus to allow the sperm to travel through the cervix into the uterus. So guys, let's continue our discussion in the causes of male infertility. So the first one is semen and sperm. A common cause of infertility in men is poor quality semen, the fluid containing sperm that's ejaculated during sex. So possible reasons for abnormal semen include a lack of sperm. So you may have a very low sperm count or no sperm at all. The next one is sperm that are not moving properly. So this will make it harder for sperm to swim to the egg. The next one is abnormal sperm. So sperm can sometimes be an abnormal shape, making it harder for them to move and fertilize an egg. So there are still many causes of abnormal semen that is unexplained. So another causes of male infertility is testicles. So the testicles produce and store sperm. So if they're damaged, it can seriously affect the quality of your semen. So this can happen as a result of, first one is an infection of your testicles. The second one is testicular cancer. So another one is testicular surgery. The next is a problem with your testicles you were born with. Another one is when one or both testicles has not descended into the scrotum. So the loose sac of skin that contains your testicles or undescended testicles. So another causes is injury to your testicles. So another cause of male infertility is sterilization. So some men choose to have a vasectomy if they do not want children anymore. So it involves cutting and sealing off the tubes that carry sperm out of your testicles. So it is the vas deferens. So your semen will no longer contain any sperm. So another cause is ejaculation disorders. So ejaculation problems that can make it difficult for men to release semen during sex. So it is the most prevalent form of male sexual dysfunction and is a common cause of male infertility. So hypogonadism. So hypogonadism is an abnormally low level of testosterone, the male sex hormone involved in making sperm. So it could be caused by a tumor, taking illegal drugs, or Klinefelter syndrome, a rare syndrome involving an extra male chromosome. So that is the cause. Medicine and drugs. So certain types of medicine can sometimes cause infertility problems. So these include sulfasalazine, an anti-inflammatory medicine used to treat conditions such as Crohn's disease and rheumatoid arthritis. So sulfasalazine can decrease the number of sperm, but its effects are temporary and your sperm count should return to normal when you stop taking it. So anabolic steroids. So, anabolic steroids are often used illegally to build muscle and improve athletic performance. So, long-term abuse of anabolic steroids can reduce sperm count and sperm mobility. Chemotherapy. So, medicines used in chemotherapy can sometimes severely reduce sperm production. Another one is herbal remedies. So, some herbal remedies such as root extracts of the Chinese herb, which is the Tripteridium wilfordi, can affect the production of sperm or reduce the size of your testicles. Now let's move on to the infertility treatment. There are three main types of infertility treatment. So these are medicines, surgical procedures, and assisted conception. So it includes the IUI and IVF. Okay, so the first treatment that we will be discussed is medicine. Common fertility medicines include clomiphene. So it encourages the monthly release of an egg in women who do not ovulate regularly or cannot ovulate at all. The next one is tamoxifen, an alternative to clomiphene that may be offered if you have ovulation problems. The next one is metformin. So metformin is particularly beneficial for women who have PCOS. So the next one is gonadotropins. So it can help stimulate ovulation in women and may also improve fertility in men. So gonadotropin, releasing hormone and dopamine agonist. So other types of medicine prescribed to encourage ovulation in women. Some of these medicines may cause side effects, so such as nausea, vomiting, headaches, and hot flashes. The second form of treatment in infertility is cervical procedures. There are several types of surgical procedures that may be used to investigate infertility problems and help with infertility. So the first one is fallopian tube surgery. If your fallopian tubes have become blocked, you may need surgery to repair them. So this surgery can be used to break up the scar tissue in your fallopian tubes, making it easier for eggs to pass through them. Endometriosis, fibroids, and PCOS. So laparoscopic surgery is often used to treat endometriosis by destroying or removing fluid-filled sacs called cysts. It may also be used to remove submucosal fibroids, which are small growths in the womb. Another treatment is correcting an epididymal blockage and surgery to retrieve sperm. The epididymis is a coil-like structure in the testicle that helps store and transport sperm. So sometimes the epididymis becomes black, preventing sperm from being ejaculated normally. So if this is causing infertility, surgery can be used to correct the blockage. The last form of treatment in infertility is assisted conceptions. So the first one is intrauterine insemination or IUI. It is also known as artificial insemination, which involves inserting a sperm into the womb via a thin plastic tube passed through the cervix. So sperm is first collected and washed in a fluid, and the best quality specimens are selected. The next one is in vitro fertilization or IVF. So IVF is when an egg is fertilized outside the body. Fertility medicine is taken to encourage the ovaries to produce more eggs than usual. So eggs are removed from the ovaries and fertilized with sperm in a laboratory. So a fertilized egg or embryo is then returned to the womb to grow and develop. Okay, so the last assisted conception is egg and sperm donation. If you or your partner has an infertility problem, you may be able to receive eggs or sperm from a donor to help you conceive. So treatment with donor eggs is usually done using IVF. This ends of my report, guys. Once again, I am Arlene Villegas from Group 7. Thank you for listening.